Bismillahirrahmanirrahim. I am Dr. Shahlla Kanwal, working as a consultant obstetrician and gynecologist in Tertiary Care Hospital, Pakistan. Today's topic of my skill demonstration is breech delivery. Breech incidence of breech at term is around 3 to 4%. There are the three types of breech. Flexed breech. The flexed breech are when there is flexion at both knee joint and hip joint. Please came closer. Now it's a flex breech where the flexion at the both hip joint as well as the knee joint. For extended breech, there is flexion at the hip joint and extension at the knee joint. This is the extended breech and this is footling breech. These are the three types of breech. When the patient present to you with breech presentation, you have three options. Number one, assisted breech delivery, external cephalic version and cesarean section. External cephalic version is a good option for every patient but there is certain prerequisite for external cephalic version. If the baby is successfully external cephalic version is successfully done, we can avoid the lower segment cesarean section. There are the certain prerequisites for assisted breech delivery as well as for the external cephalic version. To select the patient, for the assisted breech delivery, there should be no prior surgery like myomectomy or cesarean section. Patient breech should be flexed or extended, and footling breech needs cesarean section. Number 3, there should be estimated fetal weight less than 3.5 kg. Liquor should be adequate and placenta should be upper segment. Placenta, low-lying placenta is also the contraindication, as you all know, for the normal vaginal delivery as well as for the assisted breech delivery. External cephalic version, the fetal attitude of neck should also be flexed if we want, or with all these prerequisites. If we want to ECV, then you have to go for like ultrasound, which will show that showing the fetal leg should be flexed. That would be the good candidate for external cephalic version. Now I'm going to demonstrate the assisted breech delivery. As always, I demonstrate my students or always tell my students, always start any kind of skill with the fulfilling all the prerequisites and ruling out all the contraindication. What would be the prerequisites? I have already told you about the prerequisites for the assisted breech delivery. And contraindication like previous surgery, estimated fetal weight is high, and liquor is inadequate or the scanty, and placenta is upper segment would be the contraindication for assisted breech delivery. But before performing the assisted breech delivery, you have to take the informed consent after explaining all the benefits and risks to the couple. Now I will start with the skill demonstration. When breech distends the vulva and doesn't recedes back, it's time to shift the patient to stage 2. Make sure the presence of pediatrician to assistant as well as the anesthetist. If patient has epidural, then top up the dose of epidural analgesia. But if there is no epidural, then infiltrate the perineum with 1% lignocaine to give the episiotomy or to anesthetize that area, and then perform the right mediolateral episiotomy. When you have shifted the patient after gowning and gloving and with the presence of 2 assistants, you have to clean the vulva with antiseptic solution. Bladder should be empty. There should be adequate uterine contractions. But as we all know, the breech delivery is the masterly inactivity. Now try to deliver the breech spontaneously until the leg of the baby are delivered. But if the legs are flexed, they will be delivered spontaneously when the breech distends down. But if they are extended, you have to perform the Penard maneuver. What is Penard maneuver? I will demonstrate on this dummy. When the legs are extended, you have to put your middle finger in the popliteal fossa. This is the extension. When you have to put the index finger in the popliteal fossa and middle finger over the knee joint, and by flexing the leg, you have to deliver the leg. like I have putting my index finger in the popliteal fossa and my middle finger over the knee joint, and by flexing I'm going to deliver the legs. Now you have to deliver the baby, allow spontaneous to deliver the baby spontaneously till and the back should be interior till the uh, cord is visible. Now, when there is a cord visible, you have to wrap the baby in the warm, moist towel and hold the baby with the two thumb on the sacrum and the two finger over the anterior superior iliac spine. Loosen the cord, check the pulsation. After that, allow the baby to deliver spontaneously until the inferior angle of the scapula is visible. It's time to deliver the arms of the baby. If they are flexed, if they are flexed, they will be in occipital anterior, they will be in this direction in the, because they are using maximum the anterior posterior diameter of the pelvic outlet. If they are flexed, they will be delivered just by hooking the finger. But if they are extended, these, like if they are extended, then what you have to do, you have to perform the Lofset maneuver. In the Lofset maneuver, what we have to do, we have, now the baby is in a pelvic outlet, you have to rotate the baby through 180 degree so that the anterior arm will be delivered. Again, you have to rotate through 180 degree, that posterior arm will become the interior and this arm is also delivered. Now it's time to deliver the fetal head. There are the three methods or the three methods by which we can deliver the head. One is the Piper's forceps. Ask the assistant to hold the legs with the right hand, hold the leg. Assistant will hold the leg, and you have to apply the forceps like in the usual fashion, as we apply in the cephalic delivery. Then you have to deliver the baby by in J-shaped manner along the curve of the pelvis. Then the second is is the breech extraction. Breech extraction is done when there is a twin pregnancy and second twin is the breech. You have to hold the baby from its feet and you have to deliver the baby by the breech extraction. Third and the most important method is Mauritius Meningite maneuver, in which you will hold the baby on your dorsum of the hand of the left hand, and you will put the fingers, two fingers, index and red finger or the malar eminence, and middle finger, ring and index finger or the malar eminence, and middle finger over the fulcrum of the baby. And with the right hand, you have to put the middle finger over the nape of the neck and the two finger over the occiput. Now, with adequate maternal uterine contraction, you have to deliver the baby by flexing the head. Put the baby on the maternal abdomen after the delivery. Do the early essential newborn care. There are the three steps in the early essential newborn care: delayed cord clamping, early drying, prevent the hypothermia, and early initiation of the breastfeeding. As we have to prepare the abdomen already by the sheet. When the baby is delivered, change the sheet and dry the baby. Wait for 1 to 3 minutes and then apply the two cords, two clamps over the cord, one at the 5 cm, one at the 2 cm. By this delayed cord clamping, baby will get more blood and that will help to prevent the anemia. After the delivery of the baby, you have to you have to do the active management of third stage of labor with 5 international units into Synon and deliver the placenta by brain and Drew method and stitch. If then you have to check for any laceration, any tears, any heavy vaginal bleeding. Then stitch the episiotomy and do the documentation for the date, time, and the place of the delivery, and if there is any complication or any sign in the baby for any need resuscitation. So document everything in the patient's file chart. Thank you so much.